Hello, and thank you for tuning in to our video on breast cancer screening and breast cancer risk. My name is Brooke Herndon, and I am a doctor in general internal medicine. I also work with our population health team here at Dartmouth Health. Over the past 2 years, our population health team has been working hard to improve breast cancer screening for our patients. There are 2 parts to high-quality breast cancer screening. The first is routine mammograms, which you've probably already heard a lot about. The second part, which you may have heard less about, is making sure that women who are at above average risk get the special care that they need. We'll take a moment to talk about each of these. Currently, there are 4 major U.S. professional society guidelines for breast cancer screening. Each of these recommend that women get regular routine screening mammograms. One thing that's important to understand about all of these guidelines is that they're intended for women at average risk. Women at higher risk may need more personalized screening, but how do we know if we're at average risk or not? To help answer this question about breast cancer risk, we included 7 questions in a survey that you answered before one of your annual clinic visits. The questions we asked about breast cancer are shown in the letter that we sent you. If you answered yes to one of these 7 questions, your provider might recommend a referral for you. There are 2 types of referrals that might be helpful. The referral could be to a genetic counselor who would talk with you about genetic testing, or if you've had breast cancer before, the referral could be to a breast specialist. I'll review these 7 questions with you now. Question 1. Have you ever had a breast biopsy and been told that you have atypia or lobular carcinoma in situ, which is sometimes called LCIS? If you responded yes to this question, your provider may want to talk with you about whether a referral to a genetic counselor would be helpful. The genetic counselor could help find out if you're at average or above average risk for developing breast cancer. Question 2. Do you have any first or second degree relatives on either side of your family with any of the following conditions? Breast cancer in a man, ovarian cancer, female breast cancer diagnosed before age 50, or estrogen-negative breast cancer diagnosed before 60 years old. If you responded yes to any of these questions, your provider may want to discuss whether a referral to a genetic counselor could be helpful. Question 3. Do you have 3 or more people on the same side of your family who had breast or prostate cancer? For example, 3 uncles on your father's side with prostate cancer, or 3 aunts on your mother's side with breast cancer. If you answered yes to this question, your provider may recommend a referral to a genetic counselor. Question 4. Have you ever had genetic testing to look for an increased risk of breast cancer, such as BRCA1 or BRCA2? If you answered yes to this and your testing was before 2015, your provider may suggest a referral for genetic counseling because there have been updates in genetic testing since that time. Question 5. Were you ever diagnosed with breast cancer? If you answered yes to this question, your provider may suggest a referral to the DH breast program or to your local breast specialist. And if you were diagnosed at age 50 years old or younger, you might also be referred to a genetic counselor. Question 6. Were you ever diagnosed with ovarian cancer? If you responded yes to this question, your provider may suggest a referral to a genetic counselor if your previous testing was more than 5 years ago. Question 7. Were you treated with chest radiation therapy for Hodgkin's lymphoma before age 30? If you responded yes to this question, your provider may suggest a breast MRI, which is a special kind of imaging. So in summary, we've reviewed a lot of information and it may sound complicated, but there are really only 2 things that you need to remember. First, it's important to get regular screening mammograms every 1 or 2 years, starting no later than age 50. And second, we recommend that you review the letter we sent you with your primary care provider at your next routine annual visit. Together, you can decide if genetic counseling or consultation with a breast specialist would be valuable for you. Finally, we hope this information has been helpful to you, and we thank you for receiving your care at Dartmouth Health.